Case of diabetes, not on medication, and hypertensive, and patient is having a complaint of trauma in the right foot for 5 days back. Patient was having initial swelling in the right foot, and then it progresses. Patient had taken medication outside for it, and he said that the swelling and the redness subsided gradually. And he came here today for
Okay,
pain.
there are two main complaints. One, he is known diabetic for about 10 years, and the second complaint is that he sustained trauma to the foot about 5 days back. Abhi, khamosh rahiye. So after the trauma, he had penetrating injury to the plantar of the foot, and there was some foreign material inside that, and he visited some doctor and they removed that foreign body, and then he was given some treatment. We are not fully aware of what treatment it was, but the disease started increasing, and it involved the interdigital clefts and also the dorsum of the foot. The plantar of the foot is already affected, and now the patient has come to us. He has taken treatment at different places, but to no response so far. So now when you get a patient like this, where the patient is a known diabetic and hypertensive, and he has injury to the foot, the first thing which comes to mind is that is it a complication of the diabetes which has resulted in the aggressive disease which has taken place in this case. So before we go into the details, you have to think of what is the inspection and palpation findings. Before that, you will definitely like to do a general examination in which you will measure the vitals, including the pulse and blood pressure, and you will also have a systemic examination and also a local examination. In the systemic examination, this has to be seen in the terms of whether it is a disease involving the only one limb or both the limbs, and is it an arterial disease or a venous disease. Now, venous disease would have bluish discoloration and varicosity of the medial side of malleolus. So in this case, there is no varicosity and there is no bluish discoloration of the limbs. The other possibility is an arterial disease. Now, arterial disease in this age is of various types. One is atherosclerosis, second is diabetic foot, and third is a gangrene which occurs because of the complication of atherosclerosis. So now this patient, we have to see whether this patient has an arterial disease or a venous disease by clinical examination also. So in clinical examination, what you will see, first you have to see the pulses. So if all the pulses are diminished or on one particular side is diminished, it indicates a vascular disorder. So now we will just check his pulse in the upper limb. This is normal. This is also normal. Then you have to see for dorsalis pedis and posterior tibial. Now this is the place for dorsalis pedis, 1 centimeter below the joint line, lateral to the tendon of extensor hallucis longus. It's a feeble pulse and not very not palpable. Similarly, in between also posterior tibial, again it is not palpable on the left side. On the right side, again you have to see at the same place there is some pitting edema. That means there is edema plus there is absence of the dorsalis pedis and there is absence of the posterior tibial. So it is a vascular disease. because there is a pre-existing vascular lesion. The blood supply to the distant part of the limb is compromised because of the pre-existing vascular disease. That is age, hypertension and diabetes. All three of them contribute to the poor vascular supply of the lower limb. Otherwise, in a normal healthy person, any injury followed by treatment results in healing. But in those patients where there is compromise of the blood supply and added infection plus diabetes will not allow the wound to heal properly. So what has happened is that because the blood supply to the lower limb is compromised because of the diabetes and of course peripheral disease, that is diabetes, and also he is having hypertension. So all these contribute to peripheral neuropathy and leading to weak neuropathy, plus diabetic patients have lot of carbohydrate and sugar collected in the tissues, and these are good culture media for the development of infection, and later on it takes a long time to heal. So angiopathy and also neuropathy. So these three things contribute to the development of a diabetic foot. So now we will go into the details of this. That what is the idhar? You make a photograph. First you take the, you have to check, compare both the limbs for temperature. This limb appears to be warm and this appears to be cold. This is cold because again in this limb also there is vascular compromise because of the atherosclerosis and diabetes. Here, since there is infection, the local temperature appears to be warmer. You palpate. First the normal side. Compare. तुम भी देखो. Here, check here. So now you see, normally we say that a diabetic foot or a peripheral vascular disease will have lower temperature than the normal. But in this case it is the reverse. Why it is reverse? Because there is active infection. So there is inflammatory reaction, and because of that there is cellulitis, and this is leading to increase in the temperature. So that is one thing. And you can see also here there is no pitting edema, and here you will see, you see a definite pitting edema. Gloves leke aao. So on inspection we can say that there is color change on the foot and the leg on the front, and there is complete edema of the foot, and there is pitting edema in the dorsum of the foot, the interdigital cleft, and also in the third interdigital cleft on the front, and there is edema and there is cellulitis. So there is and there's foul smelling, dirty pus in the interdigital clefts with multiple blackening and whitish areas extending to the plantar aspect. This, what we are saying, is the dorsal aspect, where you see ulcers with blackening and pus discharge in the second and the third intercostal spaces. The last one also has some infection, but not so much. Now on the plantar aspect, also come here from this side, the infection is extending about 1.5 centimeter distal to the digits, and rest of the plantar aspect is okay except for edema. So the disease is not confined to the dorsum, it is also involving the plantar aspect of the foot. And there are this nails are also not properly trimmed, and there is some wrinkling of the skin on this side, and there is some pus discharge in the interdigital cleft, and there is ulcer also going deep inside. So with this, and now examine the other limb, this appears to be normal, as the skin is normal, there are no ulceration. However, the nails are not normal, and the plantar aspect is also healthy as of now. So what we have found is that अंगूठा चलाइए, इसका अंगूठा चलाइए. There is no abnormality in the movement, and we will check for छूने से चूटी काट रहे हैं तो दर्द हो रहा है. आंख बंद करिए, आपको गिनना है 1 2 3 जहाँ छुएंगे. पहले बोलिए 1, जहाँ छूने का महसूस हो वहाँ नंबर बताइए. 2 3 4 इस तरह से. 2 3 बोलिए. 3 4 5 6 7 8. There is some loss of sensation also in the affected limb in those areas where there is ulceration. Although it's not so much, so what it indicates, there is neuropathy. है ना? So this patient now has इसके अलावा और कहीं पे कोई जख्म तो नहीं है. पहले भी अगर आपको कोई जख्म होता था तो फौरन ठीक हो जाता था, समय लगता था.
ऐसा था साहब, 8-10 दिन पहले मेरे सिर पर चोट लगी थी. समझे?
है ना? This is a elderly patient who is known diabetic and known hypertensive, and he met with an accident, and there was a foreign body on the foot which was taken out by a local practitioner, and he was given some treatment in the form of drugs. We are not sure what was. Then after 2-3 days he developed multiple ulcerations of the dorsum of the foot and also involving the plantar of this foot. On evaluation, we have found that the local temperature is raised, there is pedal edema, pitting type, and multiple ulcerations, and the left limb appears to be normal. So, whenever you have a patient with, this is now known as a gangrene. Gangrene, there are two types, dry gangrene and wet gangrene. So, dry gangrene occurs in those areas like Raynaud's disease, or Burgess disease, or chilblains, or those areas where this cut off of the blood supply because of shutting down of the blood vessels become contracted. In a wet gangrene, there is pus discharge and there is swelling and edema. So in this case, since there is edema, there is pus discharge and there is ulceration, and there is a history of trauma. So now it fits into the diagnosis of a wet gangrene. Whereas if it was a dry gangrene, then you get just blackening and there will be no pus discharge, there will be no edema. So that is how we differentiate a wet gangrene from a dry gangrene. That is always a question in the examination. Now once you know that it is a wet gangrene, so wet gangrene can be because of local sepsis or it can be because of diabetic foot. So local sepsis would have been, if he was not known diabetic, it would have been a simple local sepsis, that is say Staph aureus or E. coli. These organisms, they tend to have a certain infection which is having a lot of edema. But in this case, we know that he is a known diabetic. So already he is having all those predisposing factors for the development of a non-healing type of ulcer. So now, once we know that it is a diabetic foot, the first thing, how do we manage this case? So first of all, you have to have blood sugar level, you have to do HbA1c, and also check his hypertension. So all these things need to be controlled. Now regarding the local management, first of all, you have to control his blood sugar. Otherwise, whatever you do, the patient will not have a healing starting, because of the problem in the diabetes. Then you have to do a debridement. So this debridement has to be very extensive and remove all the dead tissue till you get a red healthy area, and it should not be so extensive that the skin needs to be covered, if that is possible, because healing of a split thickness graft will not take place in a diabetic foot easily. So you have to be conservative, but you have to remove all the dead tissue. That is the most important part of this. Plus, he should be given antibiotics, initially empirical, and then you take a pus culture and get the right antibiotic which is to be given. Daily debridement is to be done depending upon the extent of the disease. If it is increasing, you have to remove the dead tissue and continue with the diabetic control. So within 3 to 5 days, the wound should be healthy and antibiotics should be known which exact antibiotic is effective in this case. And gradually you have to trim the nails also in both the limbs, because that is very important also. And start his physiotherapy, ask him to move his toes, and within 7 to 10 days he should have a normal healthy limb if the infection is controlled properly. If the infection is not controlled, then the risk is that it will go deeper and involve the whole of the dorsum and the plantar aspect also, and sometimes even the bones may be involved. So diabetes, once you have a diabetic foot, it is an emergency, and you have to take the help of diabetes experts and also physiotherapists, how to best manage this case. So it is going to be a coordinated management. It's not that you are alone going to manage. Your part is debridement, antibiotics, and daily dressing. And accordingly, you get the culture report and you manage it. So I hope this patient will be managed the way I have said, and hopefully this patient will get better. Thank you.